Number 138 on the top, this is new. I guess you're going to Partners Pharmacy for pharmaceutical services for patients at Runnells. It looks like you're saving $100,000. I'm excited about that, being a taxpayer. I'm just wondering, how did it come about going to Partners? How long have they been in business? And I guess you compared to last year that you saved $100,000, but what about the year before? What did you spend the year before? I know you're talking 2 years ago, so maybe you might have to be able to answer that.
Madam Chair, members of the Freeholder Board, the County of Union Runnells Hospital has utilized Partners Pharmacy for approximately 8 to 9 years. They have been in business probably 15 years. This contract was let due to an RFP process. There were responses to the RFP process. We went through the entire process of evaluating each of the proposals, and we received the best dollar value through Partners Pharmacy. That's why they were selected. That's why I'm asking you to approve this resolution this evening.
Thank you. Mary Palazzano, Westfield. I'm a Union County resident as well as an employee of Runnells Hospital. Madam Chairwoman, please pardon my ignorance of how this goes because I haven't had the luxury of attending one of these meetings before. However, several points I have to ask. In regards to Partners Pharmacy, it was intimated that there was a savings, and as a person working at that facility, I have to say, there may indeed be a savings with Partners, but there is a large amount of waste as well. There are hundreds and hundreds of medications that we throw out because we're not allowed to keep them and we're not allowed to return them. So when too many medications are delivered for a particular patient, they get wasted. But that's putting, as far as I'm concerned, putting the cart before the horse, because I really came here this evening to find out what is the board's position on the fate of Runnells Hospital.
That information, anything that you'd like to speak on that's not on here, you can talk about that at the end. There's another time period where you will be able to ask questions.
Okay.
And right now, we only have questions that we are getting, any comments in reference to what we will be voting on right now.
Thank you.
You're welcome. And thank you for the information in reference to that resolution.
Mary Ellen Taylor, Berkeley Heights. Madam Chairman, hearing the comment of the wasted pharmaceuticals in that facility really concerns me, and it puts a flag up that we are talking about. You put a contract to these people, and obviously nobody has been monitoring how much waste is there. So you really don't know if they're the most efficient. You don't know if the medications are being administered properly and if people are being over-medicated, because it doesn't seem like there is any way of monitoring this. Because if they know they're throwing out and you've given another contract to this person, you have no metrics, you have no measurements, and shame on you for signing that kind of contract, and whoever is responsible for monitoring that in that hospital flags up. There are elderly patients in that hospital that may be being harmed. Thank you.
All right. Dr. Miller, if you can speak to 138, please.
Good evening, Madam Chair, members of the Freeholder Board. I'm really pleased to hear that people are asking what's happening to the medications that have been dispensed by the pharmacy and not administered to the patients. I've been trying since Medicare D was approved by the federal government to find out why we cannot receive less than a 30-day dose, why we cannot send these medications off to people who are unable to afford them. We are not by federal law allowed to do that. They have a dispensing regulation, which the pharmacy has to follow. I have an administration regulation, which must be followed by every nurse in the building. And if that's not being followed, then we better watch, and I will look at all nursing practices in the building if they feel that the residents aren't receiving those medications. I beg the public to send letters to Medicare, to the federal government regarding Medicare D, and find out that we must dispose of those medications because they belong to each and every individual resident in that building. They are not our medications. They don't belong to the pharmacy. They belong to each and every resident. So if the doctor orders a medication, it's a 30-day supply we receive because that's what dispensing law is. We then only administer it for 2 days. We then must dispose of the other 28 days because the federal law tells us to do that. So thank you for bringing it up, and I hope that explains what's happening at Runnells.
Good evening. I am Lourdes Poita, Berkeley Heights resident. I am a nurse at Runnells. We don't make any mistake with medicines. They're overstaffed with medication. They are giving us a lot of medication that we need to dispose. That's what is really happening over there.
Can I just ask for a second? Is it the specific resolution that you're speaking to, or you're speaking of
Yeah,
the
yes,
issue that
I'm
was
talking about
raised
this
in
specific
the
138.
process?
Right, but I wanted only to focus and be clear, and everybody need to know that we as nurses, we don't make a mistake like that. First of all, we are not so many nurses at Runnells. Second, I think so the main idea will be to have a pharmacy in the same hospital at Runnells that can dispense exactly what the patient needed, not an excessive amount that we need to be able to dispose at the end. Even a few weeks ago was an incident with a relative that didn't want to take the relative out of Runnells because he wanted to have the medicine with the patient to take at home because he said, you are going to charge us. That is the situation that happened over there. And still we are dealing with partner pharmacies that really is no solution for us. They are draining our pockets. The taxpayers too.
One of the things that you are commenting on is what someone previous to you made a comment on. And as you see, our director did address what we do with the medication, but nobody stated that you all are doing anything wrong in dispensing your medication. I just want to make that clear.
The
Okay?
lady before is saying that perhaps they need to investigate if nurses are doing or giving the right dose to the patient because we are not hurting anybody there. We are giving the right dose of medication to each individual. We follow the doctor orders. The problem that we are having, they wanted to close Runnells. There are so many causes that they are producing, and one of the issues is pharmacy. Since I started to work there, I said, why they don't put a pharmacy in-house? From CVS, Walgreens, somebody that is going to give us the right amount of medication in daily basis. That we can run to the pharmacy to get the medicine, not to be waiting. It's a medication that is ordered as a start, we receive like a 24 hours later. That's not a start. And situation like that, it's like to be plain to be a nurse there. Sorry, that's all.
Thank you.
Speaker seemed to have first-hand knowledge of what's going on over at Runnells. And I understand Ms. Gruber's point of view that there are federal guidelines on how medications have to be ordered and then dispensed and then disposed of if they're not used. But the last speaker seemed to pique my curiosity. Why don't we have a pharmacy on site? And then would we be able to get around the federal regulation that requires a 30-day ordering of medication as opposed to as needed and dispensed? That's my first question, and I would actually like an answer to that question.
Members of the Freeholder Board, the Runnells Specialized Hospital does not have a pharmacy due to the fact of the explosion of medications that have occurred over the last 15, 20 years. It's been that long. Runnells Hospital was relocated in 1991. We have not had a pharmacy in that facility since it was relocated. It was determined at that point in time, and I know that sounds like a long time ago, that it was not cost effective to have a pharmacy at Runnells Specialized Hospital. I am not aware of a single nursing home in this state that has a long-term care pharmacy in their facility. It's not cost effective. Medications purchased directly from the wholesaler would require us to buy quantities to the size of which we would never ever dispense and utilize for our resident population. And my response earlier regarding nursing and errors, I was only responding to the comment made by the initial individual speaking to this about nurses and what they were doing with the medications. I was not referring to the nursing staff, which I do respect highly at Runnells Specialized Hospital, and their administration of medications to our residents.